I'm Dr. Anthony Kaveh, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist, and I'm going to share with you the top 5 easiest and highest yield health routines that I personally practice and that I recommend to all of my patients. That being said, you should discuss any routines with your doctor before starting. Collectively, these will take less than 11 minutes a day, and as a bonus, I'll add an additional tip that'll still keep you under 11 minutes. And if you think these are too easy, that's the point. I want these to be easy enough so that you can do them consistently every day for your body to take advantage of that benefit to optimize your physiology. And I'm going to share important nuances for these so that you can protect your health and your family's health by reducing exposure to contaminants throughout the day. Let's hit the timer. Number 1 is so easy. Drink a cup of filtered water right when you wake up. Your body is dehydrated from fasting overnight, so grab that 1 cup of water, not juice, not milk, so that you can begin rehydrating your body from the moment that you wake up. I personally also give my dog and cats a big hug after drinking my water to get that oxytocin flowing for the day. Back to the water though, I highly recommend drinking filtered water to minimize your exposure to contaminants, toxins, and even microplastics. We're just now starting to learn how toxic some of these contaminants can potentially be to your health and especially the health of children. So out of abundance of caution, I recommend to my patients to use a water filter by consulting the Environmental Working Group, or EWG's, tap water database that can specifically show you what contaminants are present in your zip code's drinking water from the tap. Then you can select a filter that actually filters out the contaminants in your water so that you don't waste money on buying a filter that's not filtering out what needs to be removed from your drinking water for your safety. You also don't want to be buying a cheap filter that's not effective for your tap water because that would just be a waste of money. I personally use a reverse osmosis system that I bought off the shelf from Costco, and it took me about 90 minutes to install. Number 2 is my favorite supplement. To back up first though, I don't like to recommend supplements willy-nilly to patients. There has to be a reason to recommend a supplement. Unfortunately, because of modern agricultural practices, many foods that my patients consume are actually depleted of vital nutrients. Additionally, some conditions that patients have may also deplete certain nutrients in their body faster than others. These are some reasons why some patients do benefit from supplementing their diets with a particular tablet. But choosing a supplement is not one size fits all, and I spend significant time with my patients identifying the right type of supplement, the right brand, dosing, etc. That being said, I find magnesium to be perhaps the highest yield supplement because of the effects it can have throughout your entire body, like on your sleep, on your mood, on your pain, and even on your digestive system, and even your blood pressure. Some of the problems with magnesium, though, are that the dose can vary by a factor of 4, and it depends on your kidney function. And there's also different types of magnesium, like magnesium oxide, magnesium citrate, magnesium glycinate. You should always speak with your doctor first before selecting a supplement, and this definitely is not broad medical advice. That being said, my top recommendation pick might change in the coming months as more research comes up on C15. C15 is a fatty acid, and it might be a fascinating supplement that might make big changes for humans moving forward, but we don't quite know because a lot of research is still coming out. I'll keep you posted. Other runner-ups that I personally take but wouldn't be my number 1 pick include turmeric, vitamin D, vitamin K2, ginger, and calcium. And there are some sleep aids in my stack that I recommend to some patients, but we'll discuss that at the end. But safety is always number 1, and many brands might try to cut corners and put fillers in their tablets, or there might be impurities or contaminations with heavy metals, so it's so important to talk with your doctor to find a reliable brand that's been third-party testing. It's what I do for all my patients because I'm not going to recommend a brand if I haven't done the research for them first. Do you take any supplements regularly that help you feel better? Let me know in the comments below. I'm really curious to hear about the supplements that work for you. Number 3 is around your mental health because it is so important to your physical health. Whenever possible, I recommend patients to uncover their inner locus of control instead of rely on external loci of control, like taking medications to support their mental health. Of all the self-help methods out there, and there are a ton, I highly recommend gratitude practices because they are safe, fast, easy, and concrete. It's also evidence-based because of a strong association between gratitude and depression in particular. Whether through journaling, through mindful meditation, through verbalizing and speaking with others, there are many ways to implement a gratitude practice. You need to find what resonates best with you so that you can do it consistently. While it can take less than 1 or 2 minutes a day, that consistency is key because practicing gratitude for 1 week or 1 month won't be as valuable as practicing it for longer. And for those of you who have taken medications for your mental health, you know that it can also be several weeks of taking that medication every day before the benefits become apparent. If you've taken medications for your mood or depression or anxiety before, and you know what I'm talking about, let me know in the comments below so that others know they're not alone. I'm not anti-medication, but I am pro-self-efficacy because it can often be safer with fewer side effects than medications, and I want to support my patients to live as healthy as they can. It's often done by uncovering that inner healing capacity. On the topic of the inner healing potential, I believe so strongly in this after treating tens of thousands of patients in surgery that I started my own health practice called Clarus-Health to help my patients uncover that inner healing potential. I'm an advocate for the responsible use of IV ketamine therapy, the stellate ganglion block, and other holistic modalities. You can learn more in the link below, and if you're learning something new, please hit that like button and share what you've learned with your loved ones. Number 4, stretching and strengthening. We all know how important it is to strengthen our muscles, but most patients have no idea how important it is to stretch. This is because the source of nearly all physical and even emotional pain lies in tightness or rigidity. This is a huge topic in and of itself, but today we'll just focus on physical tightness. Psychological tightness or cognitive rigidity is hugely important for our psychological health. More on that in a different video. Many of my patients are afraid of stretching because it can be painful. And that's the problem. We often need to lean into that stretch to really relax and lengthen that muscle which is causing the pain in the first place. In fact, that tightness is often perceived as pain in the brain even though there's no actual tissue injury. It's important to work with a health professional to set up your stretching routine, but once it's set up, most of my patients can finish their whole stretching routine in less than 7 minutes a day. For example, my stretching routine starts with my quadriceps, which I often do the night before, so I don't need to spend any extra time during the day to stretch them. 30 seconds each leg. And this is critical because the quads directly connect to your back. I also stretch my back, 30 seconds each side like you see here. And because of several injuries I've had in the past, I also need to do my wrist, biceps, and shoulder, once again, about 30 seconds each side. And lastly, that classic rotator cuff stretch to ensure flexibility of all those muscles, and this doesn't take any time because I do it while walking to work. Strengthening your muscles is critical as well, and you should always work with your doctor to find the right muscles that need to be strengthened based on your age and your physical condition. This is especially important as we age because of sarcopenia, which refers to the natural decline in lean body mass as we age. You definitely don't have to go to the gym. I just bought some weights myself and do them at home. And number 5 is our sleep, which becomes increasingly dysregulated as we age. And that dysregulated sleep can affect everything from your heart health to your metabolic health and even affect weight gain. Nearly all of my patients struggle with sleep. And while we don't know all the causes of dysregulated sleep, we do know that sleep hygiene plays a big role, even though it's not that sexy to talk about. The most important point here is that humans are the only species that I know of that purposely restrict their sleep. And nearly all humans stand to benefit by having a consistent sleep practice with high quality and sufficient quantity of sleep. Whether that means being mindful of caffeine intake, using electronics in bed, using that pesky CPAP machine, eating late, or eliminating other distractions, it can make a tremendous difference. Remember, there is no pill or intervention that I know of that can give you the same level of restoration and rejuvenation that your natural sleep can provide every night. Melatonin, valerian root, theanine can help you achieve that sleep, but at the end of the night, it's that sleep that counts. And you should never start any of these supplements without first talking with your doctor because they can have interactions with other medications. And as a bonus, I can't ignore our skin. Your skin is the window to your body, and it's so important to take care of for your physical and psychological health. It starts with hydration and sun protection, and I highly recommend you use the Environmental Working Group, or EWG's, Skin Deep database so that you can find moisturizers and sun protectants with a minimal load of contaminants and potentially toxic fillers. Remember, there is a difference between sunscreen and sunblock. Sunblock is preferable if you can find a tint that matches your skin because there's typically less absorption of the material into your blood and fewer health risks associated. Consistent moisturizing and sun protection can help keep your skin healthy and reduce the risks of premature skin aging. And there you have it, my easiest and highest yield healthier living tips. Which of these strategies do you already use and which do you want me to add to this list? Let me know in the comments below, especially if there's something else you want to hear more about from me.